That's all been arranged to the appropriate resource, so if the patient does deteriorate in the meantime, please call us back.
This is the Emergency Operations Centre for Yorkshire Ambulance Service. This is where the 999 calls are received and they are triaged and the appropriate response is determined.
My role as a specialist paramedic in the Emergency Operations Centre is to identify calls coming in on the 999 system which will be suitable for getting a different skill to the patient rather than requiring transfer to hospital.
Is the patient breathing?
When a 999 call is received into the Emergency Operations Centre, it is received by a call taker who will ask a series of questions according to an algorithm and triage that call. And they end up on what we call a stack, and our specialist paramedics are able to also view the stack and decide whether that particular call is appropriate for their skill set.
When we're looking at jobs coming in for a specialist paramedic, we are looking for falls, elderly patients, so we're looking at different types of patients that would be suitable for a specialist paramedic to see. Working in the Emergency Operations Centre and out on the road has a lot of benefits because you're clinically seeing patients, treating and discharging them in the community, and you're also identifying those jobs. When a specialist paramedic goes to see, he or she looks at the patient and looks for every reason to manage that patient at home. Because of the extra skills we have, we can do that with confidence.
Looking at the data, the general paramedic workforce will have a non-conveyance to the emergency department of around 27%. But if we are selective with the right 999 calls, have the right skill set in place, we can turn that around, and we've already proved that our specialist paramedics can have non-conveyance rates to the emergency department of up to 75%.
I can use my advanced clinical skills to assist crews who are with patients.
Is she on warfarin or any anticoagulants?
And they may be 90% sure that they could discharge that patient at home, but they need a little bit more reassurance. And by contacting the specialist paramedic, we can discuss the case and in the main give them the confidence to discharge them at home.
Specialist paramedics are a relatively new clinician in the ambulance service, so it's important that they rotate and work in the Emergency Operations Centre and develop those relationships with the paramedics and clinicians and the nurses, just so that everyone kind of understands exactly what skill set everyone else can bring to the table.
The skills we've developed as specialist paramedics are particularly useful to our colleagues who may be dealing with a case on the phone where they may trying to make a decision whether to send an ambulance or whether to refer it. Then we can probably help them with that so that we get the right skill going to the right place.
Specialist paramedics who are very used to working out on the road independently may be a little bit hesitant to come into the Emergency Operations Centre to undertake this part of the rotation. But we've found over the past 10 years with some of our other paramedics that they enjoy coming in.
I think anybody who is hesitant about working in the Operations Centre, and I must admit I was, you do become part of the team, and we bring the outside into the centre